So today we are working with Jack, a 42-year-old male whose primary concern is some left neck pain, some parascapular and arm pain. He's having some paresthesia distal to the left elbow, extending into the first and second digits. During muscle testing, he showed some weakness with bicep curl and just generally on the left side, where it was a 5 out of 5 on the right side, 4+ out of 5 for the left side. Grip strength, it was tested, and it was 105 on the right, and it was 27 on the left. Pretty big decrease there. So he has some diminished sensory abilities as well at the pad of the left second finger. So what we're going to try today is some traction. Jack is very excited about it. He's been dancing around all day. Some of the indications for traction are impingement on a nerve root, disc herniation, spondylolisthesis, narrowing within the intervertebral foramina, osteophyte formation, DJD, subacute pain, joint hypomobility, discogenic pain, and muscle spasm or guarding. So those are all things I say, hey, you should do this. It's a good idea. Precautions. If they have a history of lumbar discectomies on a single level, cervical traction specifically may be contraindicated, but considered due to hormonal influences, potentially affecting tissue laxity. Patients who report a history of cancer should have a thorough diagnostic evaluation. Claustrophobia, if they're afraid of Santa Claus, they should not be doing traction. And patients with a COPD or other respiratory disorders may find it a little uncomfortable. It's a good thing it's not Christmas time. That's all I have to say about that. Regional contraindications. Acute sprains, strains, inflammation, fractures, tumors, or localized hypermobility. Absolute contraindications are vertebral joint instability, if the movement exacerbates the current problem, so the peripheralization increases, bone diseases, osteoporosis, osteopenia, infections, vascular conditions, pregnancy, cardiac or pulmonary problems, acute cervical spine trauma, recent whiplash-associated disorders, rheumatological disorders, rheumatoid arthritis being one of those, patients who have received surgical stabilization or decompression of the spine, or spinal implants or prosthetic disc. All right, so parameters. Well, first off, we should probably talk to Jack. Let's talk to the boy. As you can see, Jack's got his eyes covered, and so do I. A classic Bobby patient bonding move. We love to see it. Jack, go ahead and wake up. I know you're dancing wore you out today.
What? Oh.
All right. How we feeling?
Oh, just fantastic.
I love to hear that.
Except my neck hurts.
Yeah. Still having those symptoms down the arm a little bit too?
Yeah.
Okay. So what we're going to do today is put you on some cervical traction.
Sounds like a plan.
So cervical traction should help alleviate those symptoms. And with cervical traction, you should notice something called centralization. So the pain you're having down your arm should kind of centralize along more of the neck, the spinal cord area.
Oh, yeah, that sounds like a great place for pain.
It's better than all down your arm, right? So we're reducing the symptoms and hopefully eventually alleviating them entirely.
Hey.
And that's what cervical traction is all about.
You got me convinced. I'm buying into it. Let's do it.
Perfect. So in order to do that, I might have to set you up on a machine. It looks like you already kind of set yourself up, which is great. Less work for me, but just want to make sure you're cool with the procedure and everything. Cool with me kind of adjusting some stuff.
Oh, absolutely.
Perfect, because cervical traction would not work otherwise. All right. So we're going to come over here to the machine. And there's an on button. Surprisingly, it turns it on. And then We're strapping Jack in a little more here. We're gonna hand him this emergency contingency button. As you can see, Jack has been handed that. So, Jack, at any point, if cervical traction gets a little uncomfortable, you're gonna just press that button.
I can push the button.
You can push the button. So typically, this
Can I
thing,
push it now?
if it's uncomfortable, so
No, not yet.
not yet. Ideally, it's not going to get uncomfortable. So ideally, you don't press it. But great question. I love that you're inquisitive. So, normal parameters, stuff we look for. We want about 7 to 15 pounds of pressure. So we're going to click the traction button. Cervical. Manual. And then time, we can do 10 to 20 minutes. So I got 15 set up here. We're only going to go to 7 pounds because Jack's a little sensitive, you know. Respectfully, Jack.
Hey, it's just a good thing I don't have osteoporosis yet.
Yeah. So, speaking of that, do you have any osteoporosis?
No, I don't. Not yet.
Do you have any spinal implants?
No spinal implants.
You're not pregnant?
I am not pregnant
Okay.
that I know of.
Hey, I'm sure at this point you would know. And then no disc or anything implanted, no prosthetic disc?
Nope.
Okay. Perfect. Now that we've cleared them of contraindications, we can start the procedure with the start button. Perfect. It is going. So, now, as always, we build patient rapport. Jack, how's that cervical traction there?
Feels great.
Perfect.
Genuinely.
Good. I'm glad to hear it. Well, time's up. It's about to beep. Look at that. So, we'll check in with the patient. All right, Jack, let's get you out of here. I can see clearly now. The blindfold's gone.
Definitely.
Cool. So, how's the neck feeling after the treatment?
Next feeling a little bit better. I would say the arm definitely feels better though.
Perfect.
Symptoms don't seem to go down as far, which is great.
Good. That was the goal. So, do you have any questions for me?
No, I don't.
Okay, perfect. Well, we'll see you next time. Maybe we'll do cervical traction again.